discussing glaucoma questions. You know, glaucoma is a very, very, very important topic in all your exams, be it NEET PG or INI-CET. You definitely have a question from glaucoma. So today we had the glaucoma telegram quiz. So let me discuss a few questions. So one question was about the resistance to aqueous outflow being maximum at. So it's actually a very straightforward question. You don't even have to look at the options. So the maximum resistance to aqueous outflow, why do you need to know about it? Because that is the one which is generating the intraocular pressure, your IOP. So the straightforward answer to that is the juxtacanalicular portion of trabecular meshwork, which is offering the maximum resistance to aqueous outflow. So what is this trabecular meshwork parts? So what exactly do we mean by juxtacanalicular portion? So basically we have three parts of the trabecular meshwork. One is the uveal part, then you have the corneoscleral part and the juxtacanalicular part. So the innermost portion is the uveal part, the middle portion is your corneoscleral, which is the thickest, and the outermost is the juxtacanalicular portion, which is offering the maximum resistance. All right. Now you have an you can actually have an MCQ for each of these three parts. One is the maximum resistance, which is the question. Then the other one is which is the thickest portion, which is the corneoscleral portion, and which offers the least resistance because it has bigger pores. So that is your uveal portion. Okay. Then what is the next question? Ocular hypertension, OHT, increases the risk of. So one option was CRAO, then CRVO, keratoconus and ARMD. See, OHT, ocular hypertension, wherein only the intraocular pressure is high, whereas your optic disc is normal. There is no visual field defect. There's no RNFL defect, nothing. Just the IOP is increased. So that is your ocular hypertension. It confers a higher risk for retinal venous occlusions. Okay, CRVO, that is the answer. So in fact, in younger patients, there is a higher risk of CRVO due to not just OHT, it can also be because of pigment dispersion syndrome and even pseudo-exfoliative glaucoma. Okay, so these are important extra things that you need to know. Even POAG is a risk factor for CRVO. That could be in older individuals. Now in younger individuals, yes, definitely OHT. So an increased IOP confers a risk for CRVO. So this is an extra point. Please note it down. So even pigment dispersion syndrome, pseudo-exfoliation also confer a higher risk of central retinal vein occlusion. Yeah. So whenever you have younger individuals, always rule out this hyperhomocysteinemia. Do their serum homocysteine levels. Okay, because that could be a higher risk factor. And then intraocular pressure. Then all these virtues tried. No, in older individuals, it's usually hypertension, diabetes, and this hypercoagulability factors are lower down in your priority list. But in younger individuals, intraocular pressure and these hypercoagulability factors are higher in their risk factors. Okay, so these are two questions, and then you can join me in the free discussion that we are going to have at 10 p.m. on the iMentor app, the rest of the questions. All right. So see you there. Just post on the chat box in the app that you want to join the quiz discussion. You will be given access. All right, guys. I hope you learned something new today. At least 4 or 5 points, new things you have learned today. All right. See you. Bye.